Our next disease is pink eye, or what is called contagious keratoconjunctivitis. It affects the eye, and particularly the conjunctiva, which is one of the part of the eye. And this particular disease is bacterial, and the spread of this disease is by flies. Flies are the one which most of the time spread this particular disease. And for this disease, there's no vaccine for this disease because there are a variety of the causative agents. You realize those the pink eye for the cow is not the same as for that of the sheep, and they keep on changing, so we don't have any vaccine for that. And the symptoms of this disease is the affected animal blinks repeatedly, especially to sunlight. This shows that the eye of the animal is so sensitive to light, and this is what we call photophobia. So the animal is sensitive to light. So anytime there is light, the animal blinks. The other one is tearing. So there is a lot of tears coming out from of the animal's eye, and you realize that the area around the eye is always wet because of the tears. If close examination is done, you realize that the membrane of the eye are red, and also they are inflamed. So there's a lot of inflammation. So that's another symptoms that can be seen when you have this pink eye disease. And eventually the eye becomes opaque. And the reason why the eye becomes opaque is because of ketones, which are part of the sugars. So the eye becomes opaque, as if there is cataracts. And at the final stages of this disease is the animal becomes blind. The animal cannot see. You have to feed on the animal. You have to direct the animal to the watering source. So this is the last stages of pink eye disease. For prevention of this disease, is you have to isolate all the affected goats from the rest of the flock, and also hygiene. We said that this particular disease is being transmitted, or is being transmitted by the flies. So it is always advisable to make sure that the animal shed or the animal house is always clean and free from the flies to prevent this particular disease from being transmitted from one animal to the other. The treatment of the disease, because it's an antibacterial, it is treatable, and we can use antibiotics. And one of the antibiotics that can be used is tetracycline, which is antibiotic. It's an oxytetracycline. The other one is a terramycin ointment. And for terramycin ointment, this one is administered in the eye in drops. Another treatment that can be done using the antibiotics is the use of penicillin. And for penicillin, this is done as an injectable, whereby the drug is administered in the eye, or at this, for example, if this is the eye, the injectable, the chemical is injected inside. Now, at this particular stage, it is difficult, if the disease has gone to mild levels, it is difficult to reverse the condition, even if you administer the penicillin. So it is always advisable to make sure that the prevention measures are put in place to prevent the animals from contracting the pink eye disease. We have covered majority of the diseases, but there are many more that affect our goats, and you can always find them in our course manual.